I'm the director of the Homelessness Policy Research Institute, or HPRI for short. And as many of you know, HPRI convenes researchers and policymakers to help design and coordinate timely, relevant, and actionable research to end homelessness in LA County. And our work focuses in 4 primary areas, which is number 1, to foster collaboration and coordination among researchers who are focused on homelessness in the Los Angeles region. We try to help translate research to policymakers and community partners to inform their work to end homelessness. We conduct rapid response policy research to inform policy and program design, and we assist in developing and coordinating different requests for research and evaluation here in the region. In front of you are table tents, which has the HPRI website address. We'd always love you to tweet your thoughts and observations from today's event or some of the world's surrounding thoughts. I mean, this has been a very busy week as it relates to homelessness, with certainly here in Los Angeles with the team from the Trump administration coming to town. I know many of you have been very busy with thinking about what that means for your practice and work. And so if you have thoughts about that, or if your work has informed that, some of the recommendations that were in the Council of Economic Advisors report on homelessness, we'd love to hear your thoughts. HPRI is always a place for that conversation to flourish. I wanted to make one quick announcement for the researchers before we get started. We have an anonymous feedback form up on our website to get your feedback and comments as it relates to the coordinated entry system evaluation that will be conducted over the next few years. Right now we're in the process of developing the RFP, and your feedback will really help to make sure that that RFP aligns well with what can be done to continuously improve our coordinated entry system. So today I'm really pleased to welcome my colleague Melissa Chinchilla, a member of HPRI's research committee, and she's going to present some key findings from her research report, Stemming the Rise of Latino Homelessness, Lessons from Los Angeles County. So right now, Dr. Chinchilla is a research scientist at AltaMed Institute for Health Equity, and previously she was a postdoctoral fellow in health services research and development at the Veterans Administration of Greater Los Angeles. Dr. Chinchilla's research rests at the intersection of housing, health, and community development. Her dissertation examined community integration outcomes of formerly homeless individuals assisted through the VA's largest homeless program, the U.S. Department of Housing and Urban Development's VASH program. Her research also examines Latino homelessness in Los Angeles County, including what is driving the increase in Latino homelessness, gaps in housing and service provision, and best practices for serving this population. Her work has been published by MIT Press and the International Journal of Environmental Research and Public Health, and she's received multiple research fellowships and grants. Please join me in welcoming Melissa to the podium.
Well, thank you for that introduction, Gary. Thank you all for being here today, and thank you to the HPRI for inviting me to share some of the work that I've been doing. I'm going to talk about a couple of things today. So I'm going to start off, as Gary mentioned, talking about the work that I did last year in 2018, specifically looking at Latino homelessness in Los Angeles County. And then I'm going to move over and talk a little bit about the work that I'm currently doing as part of AltaMed's Institute for Health Equity. And then hopefully, if we have time, we'll have some question and answers, and I'm hoping as well a discussion around research more generally around health and equity. So to start, this project, as I mentioned, started in 2018, and it largely stemmed from a desire to better understand where the conversation was regarding Latino homelessness. The Latino Policy and Politics Initiative, which is part of UCLA, it's a think tank that addresses domestic policy, challenges facing communities of color, partnered on this specific report, and the findings of this report were published by LPPI and more recently were published in the Journal of Social Distress and Homelessness. So as you all know, and as Gary mentioned, homelessness is a national concern, and locally it's a crisis. I'm going to use numbers from 2018 since the report was conducted in 2018. So in 2018 we had over 500,000 individuals that were experiencing homelessness. In LA County, which has the highest number of unsheltered homeless individuals, we had an estimated 52,000 that were experiencing homelessness. And of course, if you all have been following the point in time numbers, in 2019, we saw that this number increased by 12%. So with regards to Latino homelessness, Latinos make up about 48% of the county's population, and they represent nearly 1/3 of the homeless population. Latino homelessness in general remains an understudied subject. Previous research has primarily framed this issue around the Latino paradox, which basically suggests that Latinos are likely to be underrepresented in homelessness. The idea here is that Latinos are less likely to experience homelessness for a number of reasons, including strong social support. However, this frame does not account for the possibility that Latinos are undercounted with regards to official homeless numbers. For example, Latinos are likely to live outside of traditional homeless spaces, so we see that they use shelters at lower rates. We also see that they rely heavily on social networks, so this makes them more likely to double up in overcrowded households instead of seeking shelter. We also know that Latinos are using public services at lower rates than other racial and ethnic groups. And so this makes it very difficult to identify Latinos that are experiencing homelessness. And again, it's likely that all of them are not being captured in these official homeless counts. So this report was really a first step at trying to understand what's happening, identifying the challenges, opportunities, and then hopefully being able to provide some perspective regarding next steps. So as I mentioned, there's minimal research on Latino homelessness. For this specific project, we kind of saw it as a bit of an exploratory project. We interviewed stakeholders across Los Angeles County. These included various individuals working in different sectors such as local government, philanthropy, research and policy, legal services, affordable housing, and also homeless services. The aims of the project were really threefold. One was to understand why Latinos are becoming homeless from individuals' perspective that are some of the experts and also individuals that are providing on-the-ground services. Another aim was to really understand what efforts, if any, are being tailored to meet the needs of Latinos. And thirdly, to identify what are some of the resource gaps and some of the roadblocks that make it difficult to assist Latinos that are living in precarious housing situations. So thinking about the Latino population, it has very many unique characteristics. So for one, Latinos are a socially and economically vulnerable population. In Los Angeles County, nearly 38% of Latinos lack a high school diploma. Latinos also have some of the lowest median earnings. So if we look at men, for example, Latino men make about $35,000 a year, compared to about $79,000 for non-Latino white men. And then if we start looking at some of the numbers for foreign-born Latinos, the numbers become even starker. According to some research that had been conducted previously by the Economic Roundtable and also some research done by the California Policy Lab, in Los Angeles, Latinos are more likely to be first-time homeless. They're also more likely to experience homelessness with children. And Latino households experiencing homelessness are also more likely than other groups to include intergenerational family members. So now I want to move on and talk a little bit about the results, some of the things that we found through our interviews. So I want to begin by talking about what individuals were identifying as being some of the causes of homelessness among this population. So overall, we heard that Latino homelessness is complicated by a number of factors. This includes such things as immigration status, cultural and language barriers, and low income status as well. These factors are frequently overlapping, and they create a very complex picture of homelessness for this population. Like others, Latinos are experiencing the increasing housing costs of a tight rental market. And what we're seeing is that landlords are using various tactics to displace low-income households and increase profits from rental units. So for example, one example is the cash for keys phenomenon, in which a landlord will offer a lump sum to an individual in order to vacate a unit. And cash for keys can occur under current rent control laws. However, many renters are unaware that they are not obligated to take a cash for keys offer. So individuals are also becoming homeless from what we heard due to substandard housing. So a lack of unit upkeep may be the result of a negligent landlord, or in many cases, it's also an active tactic used to remove tenants from rent control units. Interviewees noted that immigrants and monolingual renters are often unaware of their rights. Interviewees also noted that immigrant and mixed status households are less likely to fight an illegal rent increase or an illegal eviction because they are unafraid of the involvement of immigration and customs enforcement. Interviewees noted that the current immigration climate has also impacted employment among non-citizens. So, for example, many individuals have experienced job loss, and others have also expressed fear with regards to even searching for employment because of the threat of deportation. The experts that we interviewed also noted that the criminal justice system and foster care play an important role in Latino homelessness. As all of you may know, Black and Latinos are disproportionately represented within these two systems. So some of the homeless service providers that we spoke to mentioned that outreach workers are witnessing a rise in the number of Latinos that are living on the streets. However, they're seeing fewer actually enter the agencies to seek support. The information used to create this graphic came from some of the research that was done by the California Policy Lab, which undertook research looking at fiscal year 2017-2018, looking at Los Angeles Homeless Service Authority data, which estimated that Latinos made up about 35% of the homeless population. However, they represented 30% of those being engaged in initial homeless outreach. And then when we actually look a little bit more with regards to access to housing services, Latinos were engaged at even lower rates. So for example, they made up only about 21% of those being placed into permanent housing. So we wanted to ask interviewees why we're seeing this lack of service engagement, and they really attributed it to a couple of different reasons. One was that there's a lack of familiarity with the homeless service system. So as mentioned previously, Latinos are likely to be first-time homeless, which means that they're frequently unaware what services are available and how to access these services. Another thing that we heard was that there are gaps in service provision. So individuals that become homeless generally like to stay in the area where they were previously housed. This is likely due to social networks, as well as perhaps if they're working, they're close to the place of employment. So if a community is not service rich and there are gaps in homeless services, this creates barriers to service utilization because individuals do not want to move to another area in order to receive services. Another thing that was brought up by interviewees was that language and cultural barriers are impacting engagement. So for example, a lack of translation of services and also of documents needed to be filled out in order to obtain services makes it very difficult for individuals to apply. One interviewee noted that some agencies, such as the Department of Public Social Services, offer translation services. However, individuals have to actually be eligible for these, for the services offered by the departments in order to qualify for translation services. So if they don't qualify, they are not able to use them. Homeless service providers and outreach workers, they also believe that there's a reluctance to engage in services due to cultural differences in how Latinos perceive the experience of homelessness. So when offered services, a lot of folks mention that Latinos express a lot of pride and or shame and are reluctant to take services offered. In addition, they mentioned that many folks do not really identify with mainstream perceptions of homelessness. So instead of seeing themselves as homeless, they often see themselves as part of the working poor, and they see homelessness more so as something that they can remedy through their individual perseverance. So I want to give an example from one of the interviews I had with an outreach worker. And the conversation was, one of the things that he mentioned through our conversation was that outreach workers, if they're unaware about cultural differences, a lot of times they can see the refusal of services as being that an individual is uncooperative or service resistant. So he illustrated this point by sharing an experience that he had conducting outreach. So he mentioned that during outreach work, he came across a Latino family that was living in an RV. The head of household was a male. He was the oldest son. And he stated that they did not need assistance, and he expressed confidence in moving his family to permanent housing. So he basically told the outreach worker, I'm employed, we currently have an RV, we're fine, we don't need any assistance. But the outreach worker mentioned that it was very clear that the family was living paycheck to paycheck and was in notable financial distress. The outreach worker, who he himself identified as a Latino male, considered the family's circumstances along the cultural context. So he viewed the head of household's refusal for services as being strongly influenced by a sense of pride, a sense of responsibility to family, and an inability to recognize that individual perseverance alone could not remedy the situation. So capitalizing on the head of household's sense of responsibility, this outreach worker reframed the conversation from one about him, the head of household, receiving services, to one about the head of household allowing his family to benefit from service receipt. So by shifting the conversation to focus on the manner in which homeless services might benefit the individual's family, in helping it might benefit the individual's family and also help assure that this head of household was meeting what he perceived as his personal responsibility for his family's well-being. The outreach worker was able to convince the head of household to engage with homeless services, and so they were able to get that family into a motel that night and then begin the process of service connection. Lastly, folks that we interviewed really brought up repeatedly the issue of public charge that's become more commonly spoken about in the last couple of months. Interviewees noted that the current immigration debates and current conversation around immigration has created extreme fear about being labeled a public charge. And it has created a lot of disengagement among both undocumented individuals and also mixed status households. So folks that we interviewed mentioned that a lot of people would refuse services for fear that it would count against their legal proceedings for citizenship, for example, or legal proceedings to remain in the country. So I want to talk a little bit more about public charge. So public charge, being labeled a public charge affects whether or not, can affect if someone is interested in one day becoming a U.S. citizen or a permanent resident or changing their status. Being labeled a public charge can deem this person ineligible. So currently not all programs label someone a public charge. So there are only two reasons that someone can be labeled a public charge under current process. So one is a receipt of public cash assistance for income maintenance, and the other one is institutionalization for long-term care at government expense. So in addition, under the current rules, a non-citizen parent may be eligible for may not be eligible for government programs. However, their U.S.-born children can. So they can receive things like supplemental nutrition assistance from government programs. However, the Trump administration has proposed expanding the definition of public charge, and this would include non-cash assistance. So for example, it would include medical assistance, it would include public housing, and also if a non-citizen, if their children are receiving services, it is likely that the services received by those children would count against the individual's immigration case. The latest is that on August 14th, the Department of Homeland Security published a final rule related to public charge. And according to DHS, the rule will take effect on October 15th. However, there have been over 10 10 states that have filed lawsuits against the proposed rule. So it is likely that this will remain in litigation for a while, so it's still unclear how this will be implemented. And then lastly, with this specific project, I want to talk about some potential policy solutions and just some next steps as well. So as I mentioned, I really see this research as only a starting point to begin to have a conversation around what's affecting the Latino experience when it comes to homelessness. I do believe that we need more research on this population to better understand the needs and identify best practices. We need to understand how Latinos are navigating through the homeless system. We also need to pay better attention to what are best practices that are culturally informed for outreach. For example, what is the role of the family when we're talking about engagement? In addition, something that could be very immediate, we need to increase awareness of services that all individuals qualify for, regardless of their citizenship status. And we also need to promote greater partnerships between legal and homeless services. So these partnerships are very important, especially when we get into the questions around public charge, as many times it's not clear what services actually fall under this purview. We also, through my conversation with the folks that I interviewed, one of the things that they mentioned is that Latinos are not really seeking services from what we would consider traditional homeless service providers, and that they're more likely to identify themselves as experiencing homelessness in places that they trust. So for instance, medical clinics and also churches were frequently mentioned. Other literature on Latinos and engagement, for example, some of the political science literature shows that the trusted messenger is incredibly important for the Latino community. And I think that this is also the case here when it comes to homeless services. Lastly, with regards to affordable housing development, one of the things that was mentioned is that currently applications for development funds give no real advantage to organizations that are working in and have a relationship with the community where they propose to build. And we know that having a relationship with the local community is incredibly important to get support for affordable housing construction. So that's something else to consider. So I want to move on to my current role and then some of the research that we're hoping to undertake at AltaMed. And then hopefully we have time for some discussion. So for those of you that don't know, AltaMed is a health system. It started in 1969 as a free clinic in East Los Angeles. Today it's designated a federally qualified health center, and it has over 40 sites in LA and Orange County, providing health care to over 200,000 people. And an interesting thing about AltaMed is that over 80% of the population it serves self-identifies as Latino. Since the passage of the Affordable Care Act, the number of patients that are being served by AltaMed has more than doubled. AltaMed has grown very rapidly, and it's transitioning to a value-based healthcare system, which means that any reimbursements it receives are dictated by patient health outcomes instead of the number of services rendered. So this is a new model for how they're providing healthcare. As part of AltaMed, we have the Institute for Health Equity, which is what I'm part of. And the Institute for Health Equity was really established to undertake research aimed at improving patient outcomes. Research produced under the Institute will move beyond the clinical setting to also consider social determinants of health, and this includes housing instability as well as homelessness. So with regards to homelessness, in the last several years, AltaMed has seen a significant increase in the number of patients identifying as homeless within its healthcare system. So between 2011 and 2018, this number increased by more than 200%. Currently, AltaMed has been able to identify 2,000 patients in its system that are experiencing housing instability. However, it's likely that this number is an undercount, as currently there is no systematic way to assess for housing instability and homelessness. So primarily, these individuals have been identified through inpatient care or emergency services, oftentimes at the point of discharge. One of the things about AltaMed is that it's not designated a homeless healthcare provider. So this means that it really doesn't receive additional funds to support provision of services to this complex population. The majority of the patients are Medi-Cal managed care patients, for which AltaMed receives a per member per month capitated fee from health plans. However, it's very apparent that this population has complex needs and that it needs additional resources. And AltaMed recognizes that if it's moving to a value-based system, it will need to improve health outcomes among this population, and it'll have to assist its homeless patients in connecting with local services to meet their housing needs. So I want to just give two quick examples of the types of patients that AltaMed's seeing that are experiencing homelessness, and then I want to talk a little bit about where AltaMed's going and then potential research that's going to be undertaken. So patient one is really an example of housing instability in a multi-generational context. This case touches on issues of immigration as well. So this specific patient is a 70-year-old male who identified his family as experiencing housing instability. The patient has two siblings, a 15-year-old and a 22-year-old. All three were AltaMed patients. Their parents live in Mexico. The two youngest live with their grandmother, and the 22-year-old is homeless. So the grandmother is not a legal resident, and her income is only $590 a month. She rents a room for $550 a month. Occasionally, she sneaks in her 22-year-old grandson to her home. However, she's not allowed to do this due to the rental agreement. So if they find out that he's sleeping there, there's a possibility that she'll be evicted. The grandmother, they struggle for the basics, food, clothing. The grandmother primarily receives assistance from a local church. Another example of a patient that AltaMed has seen in its clinics is patient number 2, which is a male diagnosed with cancer, going in and out of AltaMed's clinic and emergency room. The patient is homeless. He lives in his car. He has no family in the U.S., and he has a hard time taking care of himself due to not having any income. So currently, AltaMed has no system in place in order to assist homeless patients. Individuals are frequently referred to services by case managers or community workers, but follow-up with these individuals is difficult. So one of the things that AltaMed's currently working on is piloting a new program. This program would be piloted in SPA 7, which is where AltaMed has identified the largest need among patients experiencing homelessness. AltaMed would coordinate with clinical staff and homeless service providers in the area. So the idea is that AltaMed will be hiring a social worker and a community health worker, which will float between AltaMed clinics and the spa according to patient needs. This individual will then connect with the partner organization, which has been identified as SPA Lead, coordinated entry spa lead, Healthline Youth Counseling, and then they will assure that this individual is entered into the coordinated entry system and also connected to homeless services. So one of the project pilots that we're hoping to undertake through some of the work that's happening in AltaMed is better understanding why patients that are currently referred to services and are homeless are not connecting to services. So one of the programs that AltaMed has is called the Home Visit Program. This program provides care to high-need patients that are unable to make medical appointments. And this program has been able to identify a significant number of homeless patients. And instead of being a home care program, oftentimes this has ended up being street medicine, because they've realized that a lot of the folks that are in greatest need are actually living on the streets. And so the program has been able to establish great rapport with a lot of individuals that are homeless, having a lot of contact with them. However, the program director has noticed that even though patients have been referred to services, for some reason they're not connecting. So the idea of this initial pilot project is to better understand what's happening currently with the referral process. Why aren't the patients connecting from both the case manager and the community health worker perspective? But also, why aren't they connecting from the patient perspective? So what are really the challenges there? This work has currently received financial support from HPRI. Thank you, HPRI. And then we'll also be applying to additional grants, including the Siren grant, to help supplement some of the cost of conducting this research. And then this research will be used to hopefully develop best practices for referral process, which will inform the work that AltaMed is doing and will also likely be published in academic journals. So I have this question slide, but before I wrap up, and this could be part of the Q&A or part of a later group discussion, one of the things that I wanted to bring up, which I saw a lot while conducting the initial work in 2018, were a couple of themes that kept coming up. So one's the importance of recognizing the intersectionality of individuals' experiences. So one of the things with the Latino population is that it can be complex, as well as other populations in many ways. There's issues of how people identify racially, whether or not they even identify racially. There's issues of immigration, mixed status households, age, intergenerational households. So there's a lot of things there that cut across. The second thing that I noticed that would come up a lot is that we recognize challenges and opportunities, but we also have to understand the repercussions of proposed policy interventions. And I say this because one of the things that came up specifically with regards to Latino population is that they're more willing to live in shared housing. I heard this is a way to address the fact that we don't have many housing units, and a lot of these folks are willing to share a housing unit with another family. But that leads to the question of, well, what's this really doing, right? If it is maybe providing a temporary roof over someone's head, but it's creating an overcrowded living situation. And what repercussions does overcrowding have with regards to children's development, for example, behavioral health issues? I think we need to really understand the complexities of this. And then the last thing I want to mention that came up in the work that I was doing is the importance of positioning social justice work in a historical context. Specifically with this population, large number of immigrants fleeing countries with a lot of political turmoil, a lot of distrust of government, people fleeing extreme violence and poverty. And what does that mean for how we are engaging people in outreach, or how we think about where services are being provided? Are people going to trust government agencies to receive services given previous experiences in their home country? So just a couple of themes that resonated with me and that I wanted to bring up for potential discussion.
So I have a couple of questions. I actually have a lot, but I'll just ask two. So one of I thought both the policy suggestions around putting legal and homeless services together, and then thinking about non-traditional places such as churches to actually deploy services. On that issue, my question has to do with the capacity of churches there, or maybe what we know there. And then the second question had to do with, if you had the opportunity to investigate in the data, how many Latinos are living in cars vis-a-vis other populations? Is this something that's more prevalent or equally prevalent among the Latino population, or maybe we don't know?
Yeah. On your first question regarding churches, so I think a lot of churches are already providing some sort of services for individuals, whether it be a food pantry, for instance. And my impression is in some of the Latino communities that may not have as many homeless service providers, that individuals do tend to turn to churches for service provision, but I'm not aware of how well informed churches are regarding what services are currently available for homeless individuals. So actually one recommendation would be to do some work around do churches even have information to distribute to individuals experiencing homelessness? One group that I interviewed, they were a shelter that was connected to a church. And so they found that there was they had very good rapport with individuals in the community. And they of course, they were full at capacity all the time because they had individuals coming in for shelter beds. They didn't have really a huge capacity to serve individuals. I think that would be actually really interesting to examine where are churches with regards to this issue. Do they have proper information regarding referral services? Are they connected maybe even with the local CES leads for the various spas? I think that would be a great addition. With regards to your question regarding the RVs, I hope that we can do a rapid research as part of some of the work. I'll be collaborating with you all because I have not seen detailed data with regards to the Latino population coming out of the Los Angeles Homeless Services Authority point in time count. So I would love to see that data broken down for comparisons, not only looking at the RV issue, but also maybe looking at the demographics of the population, clinical needs. Are we seeing certain, like substance use, mental health, for example, would be quite interesting as well. Are there older individuals? Does the older population different as well? So I think there are a lot of questions that are very basic demographic questions that we currently do not have the answers to, and I would love to see that research done.
So one comment and one question. Your comments about the importance of family as a lens for doing outreach really resonated with me. I used to work supporting outreach and enrollment workers for who were trying to enroll people, the remaining uninsured, in Affordable Care Act options. And we did message testing, and we found that for Latinos, leading with the family was really important for, like, no matter what their role, right? So if it's a parent, you say, don't you want your kids to be covered? If it's a kid, you say, don't you want your parents to stop worrying about you? So that just struck me. And then the question is, so LA County uses its administrative data to do its own sort of homeless estimate that it compares to the PIT count. And the last one I saw before I started working for us showed the spa breakdown. So in 7 out of the 8 spas, the homeless estimate was significantly higher than the PIT count. And the one spa where it was not significantly higher was Spa 7.
Oh, really?
Where the Latino population is disproportionately high. And I've been wondering whether that means that there is less homelessness in Spa 7, or whether it means that homelessness is more invisible in Spa 7 as a result of the Hispanic community's relationship to government services. And I just wonder if you have comments about that.
That's very interesting. One of my so when I started some of this work, one of the reasons why I was so interested in it was because I believe it was 2016 to 2017, the increase in Latino homelessness countywide through the PIT count was shown to be 55%, which I was like, 55%, that's shocking, right? And so I as I talked to people and learned a little bit more about the methodology behind it and the fact that they had switched methodologies between 2016 and 2017, I was like, okay, there's like some issues with the numbers there. And I think over the last couple of years, I've kind of become a little bit more stagnant. I would say through conversations with individuals that were on the ground, some individuals that participated in collection of data, they said that they felt like a lot of people are still not being captured by the system, not only in the PIT count, but just like they're not accessing like county services, so they're not being captured at all. And they're more informally relying on the social networks, I heard some interesting stories how individuals were experiencing homelessness. So like, for instance, I heard, someone gave me the example of like a family that they had come across. Half of the family was the son and the father were sleeping in a tent. However, the family was like a family of 5. The other individuals were staying with a relative, and they would switch off. So then 3 individuals would, I guess, not be considered homeless because they would be housed, and then 2 individuals would be considered homeless because they would be on the sleeping in the tent. However, technically that whole family is homeless. So I heard like weird things like that when it came to assessing homeless numbers among Latinos. I also heard like because of things like immigration status, for instance, that a lot of individuals prefer to like go underground and to not be counted in any kind of way. So they might like find themselves in very remote areas that are difficult to reach by outreach workers, for example, like more of like the riverbed situation. So I heard that as well. So I think, I feel like the numbers are just overall questionable, and I do think that part of it is the fact that folks are just not accessing the resources. Does that answer your question? Yeah. Okay. Thank you for your comment, by the way. I appreciate that.
Can I go? So obviously I think your research is really great. And I think it's really interesting to think about how culturally it's really different and spatially it's really different among Latinos experiencing homelessness. And I wonder if it's related to the same phenomenon, which is just that it seems like their networks are super different. And that there's both a lot more density, which can confer opportunity but also harm. And so it's like potentially, we're seeing this a lot in the survey and have been thinking about these as hypotheses that that's maybe why you see a lot more doubling up, which, as you said, can present unique challenges but also opportunities for people who are vulnerable to homelessness. And I wonder if that's almost an opportunity for reaching out to people, like if their networks are different, thinking about how not just trusted spaces like clinics and churches and maybe schools, but also through other people, if their networks are denser, maybe it's just like you could activate those really traditional spaces to find people in another way and just like use those networks to confer resources.
Yeah.
I was wondering if you had any thoughts.
Well, it's interesting you mentioned that. So I asked the agency that, the one that I mentioned was part of a church and held a shelter in East Los Angeles area. I asked them, how do folks learn about your services? And one of the things that they mentioned is primarily through word of mouth. They said, we might have someone that comes to the church who knows about the services, who then has a friend who ends up being, becoming homeless, and then they say, oh, well, I know of this church that you can go to. Like I trust them. I've had great experiences with them. So the person that I interviewed stated that one of the things that they find is that in their community, it's often the word of mouth, and having people that have had previous experiences with the organization tell other individuals that this organization can be trusted, like they provide this and this service, and just being the ones to spread the word. That organization ran both a small shelter and then also a men's, like another shelter that was like a men's shelter, but also provided food services. So the woman I spoke to said most of their services, they're just, people find out word of mouth. They don't have to do outreach. So yeah, it's an interesting point.
Thank you for your presentation. It was really interesting and much needed. I've done a little bit of work in this area and was just curious as to whether or not you thought that I know you started off your presentation with saying that Latino homelessness has been on the rise, and trying to understand that. And you just mentioned that, or sort of alluded to that, well, maybe it's not really on the rise, but it's just becoming more visible over this period. And so I was actually wondering, because a hypothesis that I kind of had was that because of the reliance on social networks, that maybe it's possible that other families are not willing to double up during this time of insecurity. And so just wondering if you had heard anything as it relates to that, because that's sort of like, I have another paper where I've sort of been putting forth that hypothesis, and just thought whether or not you had heard anything in your research. Or
Yeah, definitely. So I think there's a couple of things that have happened. One, that folks have been undercounted and are undercounted. Two, I really do think that the numbers have increased in the last couple of years. And then with regards to your comment, I did hear from folks that I spoke to that they're finding that folks have kind of exhausted their social networks at this point, that a lot of times it's been, they might have been struggling through homelessness for an extended period of time, but now it's gotten to the point where they've exhausted their social networks and people no longer want to allow them to double up or support them any further, and so they end up eventually going on the street or moving into a vehicle. Another thing that I heard, which is really interesting, is that given how competitive the housing market is and how difficult it is to find housing, that folks are finding landlords will use any excuse to kick out a tenant. So therefore, a lot of individuals that are renting fear letting someone move into the unit that is not on the lease, because that is one of the reasons for illegal eviction under rent control law. That, in addition to having, I heard some people mention fear of having like a mixed, someone who is undocumented move into their unit as well, because of the threat of having there be negative repercussions from immigration enforcement and just the complexity that may bring into the household. So I heard that as well. So it was like, oh yeah, so that's something that I heard as well. But I would imagine that may also go hand in hand with not wanting to bring someone that's not on the lease into the unit, because if you bring someone on the lease that's not into the unit, yes, you're violating your lease agreement. But if you bring someone on the lease that's not in the unit and is also an undocumented individual, that could stir up even more problems for the family and also for that individual who's undocumented. So I did hear that there's been some hesitancy around people like still tapping into their social networks and just some exhaustion of the social networks as well.
Hi, thanks for your presentation. Really enjoyed it. I guess I'm sort of a little bit in my head, but I'm relatively new to homeless services research. And what you stated about the tendency for Latino homelessness to occur in families, maybe as compared to some other racial groups. Then also, I know I read a really interesting series of articles from Steve Lopez at the LA Times right as I came on about the intersectionality of education and homelessness. So I wonder if any work has been done on sort of the impact to the children in those families, and I'm just interested to hear your thoughts kind of on how that intersection might be impacting these families.
Well, I haven't done any research specifically on family homelessness, but I do know that the numbers have increased drastically, and LAUSD has seen incredible rises in the number of students identifying as homeless. Actually, I think there's a member of HPRI, Earl, but I'm forgetting his last name. He's Edwards, yes, who's he's a PhD student at UCLA and in the Department of Education, I want to say, and he's been doing a lot of work looking at homelessness in the Los Angeles Unified School District. So he might be a great person to connect with to learn a little bit more about that. I'm not quite sure on what exact project he's working on right now, but I have seen some previous work that he did just analyzing the rise in numbers.
Yeah, we also, just on that topic, we have a team at the Price Center who's also looking at LAUSD data and this interaction between housing and stability homelessness, like over kind of their housing careers. So I'd be happy to chat on that topic as well. So I had two other questions. I always come in twos because, like I said, I had a lot of them. The first one, and then I'll ask the second one after you respond. Like, what can you tell us about the character of this intergenerational homelessness? Are you observing, actual like grandparents and grandkids living on the streets? Are you seeing in single RVs multiple generations represented, or are you seeing just that families are, like in the case that you described before, you have two people in the family who are living on the street, others who are couch surfing? Can you just say more about what that is? Because I think it has important implications for how outreach happens. Yeah, well, so to be quite frank, I didn't do much digging into the demographics. Like I said, I'd love to see some of the point in time count regarding the demographic data, like what the household composition looks like.
But from what interviewees mention is they mention sometimes you'll have parents, children, and grandparents, for instance. Like, it's not uncommon for a Latino household to have the grandparents living with them as well. So when the family becomes homeless, everyone becomes homeless, right? So yeah, I would just imagine that that's going to impact the types of services that individuals need. It might make the types of services a bit more complex if you're dealing with an elderly individual as well as children in the family. And I think actually the question of like elderly Latinos experiencing homelessness is another area that would be very interesting to explore. One individual mentioned to me, like if there's a Latino elderly person who's foreign born, never became a citizen, is not really able to access very many social resources, has no family in the area, so has no social support, and they become homeless, there are very few supports in place to assist that type of person. So looking at even the older Latino population would be really interesting. But I do think that does add another layer of complexity. The intergenerational household aspect does add another layer of complexity to the types of services that you provide. And even when we start thinking about housing and housing models, I mean, we've moved a lot towards the individual units, not family units. When you're dealing with an intergenerational household, you need larger units, right? You need units that have at least like 2-3 bedrooms. Those types of units are not necessarily being constructed. And I think that's been a conversation in the affordable housing world that's serving predominantly Latino communities for a while now. And I mean, it's a question of where the funds are going, right? The funds are going towards individual single units, and there really isn't much financial support there for the construction of larger family size units that would accommodate characteristics that are unique to those populations that tend to have intergenerational households.
I thought that your comment, it was incredibly insightful about just thinking about the kind of race equity issues as it relates to kind of policy prescription. So you talked about shared housing as a great example of this, and this even just is a great follow-up to what you just said, right?
Yeah.
Because it continues to be hotly debated. What is the right model given our constrained supply? What kind of shared housing models? I wonder if you had anything else to say on that topic based on your research within this particular population, or maybe even some of your studies of veterans could speak to the shared housing models and kind of best practices around that.
Yeah, I mean, so I think with the Latino population, one of the reasons I brought it up is because through some of the interviews, some individuals mentioned, it's easier to get Latinos into shared housing because they're more willing than other populations to share housing. Like, this is kind of, it's not very uncommon for individuals to do that in order to afford a unit. And then especially if we begin talking about, for instance, individuals that are non-citizens or undocumented and do not qualify for such things as Section 8 vouchers, then shared housing is basically the only option you have to make a unit affordable. But I think for me, this kind of raises a red flag because, we do want to talk about the strengths of communities, but we also want to think about if we are always insisting that communities rely on these, their willingness to do such things as shared housing, or to give up, some of their personal space in order to find this solution to the housing crisis. Are we really solving the problem, or are we just creating another problem in the long run, right? I think lots of studies have shown that overcrowded housing could have negative repercussions in people's lives, in the development of children, behavioral health issues. We know that it's not the ideal way for people to live. So I think for me, that shared housing question, it just raised a bit of a red flag. Talking a little bit more about when shared housing works, I think shared housing does have a place, and through my work on veterans, one of the things that I learned is that people really want options when it comes to housing. You have folks that would really enjoy having social support and sharing an apartment with a roommate that they get along with maybe and can support them on their way to recovery. But you have other people that really want their own space and that don't want to have already, maybe they've gone through the process of recovery and they don't want to be pulled back into that social space or headspace of still dealing with recovery issues that maybe the roommate might bring with them, right? So I do think shared housing has its place in a spectrum of options, but I don't think that we should look at it as being the primary solution when thinking about Latinos, for example.
Hi. I want to say first, thank you for doing this work. It's really interesting and nice to learn more about this particular subset of the population. And I wanted to ask a little bit about that, the word Latino and how you're defining it, and also how it might be broken out for immigrant versus non-immigrant, but also for country of origin. And I wonder if you were able to see any of those differences in the work that you're doing, or if the data's not there, that's okay too.
Yeah. So as I mentioned, I interviewed the higher level stakeholders. The next part will hopefully be interviewing individuals that are experiencing homelessness. I think your point about the complexity of the Latino population is so important, and it's something that no one has really delved into. Even when we're talking about political outreach to Latinos, it's like, who are they, right? Interestingly, I had another conversation about how Latinos identify racially. Some Latinos do identify racially. Fill out the census, they check off the box, and then they check off Latino. Maybe they check off Black, maybe they check off white. But many Latinos don't necessarily identify racially. I'm Latino, and when I fill out the census, I fill out other for race, because there's so much racial intermixing that you no longer know what is really your racial identity, right? And then even when we get to country of origin, there's so many complexities with that too, because everyone brings with them a different history. And that hasn't really been very well addressed either, I don't think. No one's really looked too much into that. For example, when you're talking about Central America and Central American migrants, the political situations in their country have been very different from maybe South America or Mexico, even, for example. So their experiences and the experiences that they bring with them and pass it down to their children intergenerationally are going to be very different. And I don't think that we truly understand those complexities yet. And hopefully at some point down the line, we'll be able to have a deeper conversation about how we even begin to parse out some of those differences and still at the same time maybe looking at what are some of the commonalities that cut across some of the differences. What are some of the issues that unite us as the identity of Latino?
Thank you so much for your presentation. I thought it was really, really interesting. And I was wondering if you could talk a little bit, you mentioned this phenomenon of the loss to follow-up of homeless individuals within the healthcare system and community health workers. And I'm more familiar with community health worker models in the global health context and kind of a lot of the data around the strength of those kind of programs, and not as much in the US or in California or in LA. Yeah. Are there any models that you're kind of looking at that have shown, positive outcomes of linking homeless individuals with community health workers to kind of strengthen just health outcomes?
So to use AltaMed as an example, so AltaMed they've grown really fast, and they're working on putting systems in place to better assist their population. One of the things that they have is that if a person's high need, so going to emergency or being in outpatient care, and they're identified as experiencing homelessness, then they may be referred to a case manager in the system. The case manager will then say, here are the resources that we have. You can go here, you can go there, and give them the information. And then the community health worker is in charge of following up with that individual, like, hi, were you able to connect with those services? However, what's happening is that a lot of times the health workers are not able to reach the population. They're not able to reach the patients. They lose contact with the patients. I talked a little bit about this program that is the home health visit program, which has been I think from what I've learned thus far, it's been like the main program that that has consistent contact with some of the patients that have been identified as high need and homeless. And then what they've been doing to maintain contact is that they'll tell the patients, okay, we're gonna meet at this corner on this day at this time. And they've found that about 80% of individuals actually follow up with their appointments. But when it comes to the conversation of like, okay, are you getting the assistance that you needed? Like, it just appears that it's just not happening. So we really don't know why that is currently the case. I think part of what AltaMed is hoping is that by moving towards the pilot project that I mentioned in SPA 7, where they have more of a warm handoff model, where you have a case manager who is bringing in the coordinator for the SPA on the CES side and saying like, this person needs to connect with your program, that they'll have more success with obtaining services. I think we'll have to see how that works out. I think there's might be some questions around, what that process is going to look like and what might be the best practices for making sure that those services are obtained. And from my previous conversations and some of the research I presented, I think a big part of it is going to be how the services are presented, and how the services are presented and framed, and really that relationship and interaction that the homeless service provider has with the individual patient experiencing homelessness. But we're hoping to learn a bit about that process in the months to come.
I was gonna say on that previous comment around kind of like, digging into the deeper kind of levels of identity and kind of like immigration status versus like, native born and things like that. I mean, it's not about homelessness and it's not about Latinos, but there was that study that came out a couple years ago, The Color of Wealth in Los Angeles, and it was kind of about like, it dug deeper into the different Asian American kind of ethnic groups, but it also looked at like Black African American, Black African immigrant, and kind of looking at the kind of the differences in wealth, ability to kind of obtain and maintain wealth, and looking at all the different kind of aspects of that. So it was kind of a small study and probably could have had a bigger N, I would say. But it was interesting in that like it was able to kind of show that there are some distinctions that change the ways you should approach or engage with these communities, and you can't really kind of paint them as like a monolith, right? Yeah. So I mean, and then again, there's that whole balance between like, do we come up with such specialized solutions for everything that makes us, ineffective versus like, how do we come up with things that can have the most impact while still recognizing there is nuance that we need to face into. But I think like a next level of all of this research and work could definitely be kind of digging into kind of those aspects and how that kind of changes the way that we engage with people on the street. Yeah,
definitely.
I really enjoyed this, and I definitely share some comments that have been made that I think LASA has an undercount of population. I come from LASA, and I'm the manager for the data and research unit that led the PIT count. So I fully agree. What I want to inform this audience about is that we're trying to use our data to share more details about the different populations, and we will in a couple of weeks be publishing a data summary on the Latino Hispanic population that we surveyed. And no, we're not able to get into detail about some of the things that you all have expressed interest in, but we do break out by sheltered and unsheltered, and I hope you all will take a look.
It's great to hear. Thank you.
Thanks.
Thank you for sharing that.